Hi guys, my name is Emily Simpson and I have been on The Real Housewives of Orange County for 6 years now. About 3 years ago, I believe, I decided that I wanted to get my implants removed. I had had a lot of issues with autoimmune problems. I have alopecia. I also have arthritis. I have some joint issues. And so I had read a lot about implants having an impact on autoimmune type of problems. So I did some research, read about it, and I thought the best thing for me to do was just to have them removed. Dr. Agha just really stood out to me. He was very kind. He has a very good bedside manner. He was easy to talk to. He answered all my questions. I could also tell he's very detail-oriented and meticulous, which is very important to me. I didn't want to go to the type of doctor who just runs like a factory where they're just putting implants in or taking them out, just one patient after the other. I felt like he was very invested in me as a person and my goals and what I was trying to accomplish. And I just really appreciated that. And also, I liked his personality. He's just easy to talk to. We banter a little bit. I enjoy that. I feel very comfortable with him. And I think that's so important when you're looking for a plastic surgeon, is that you find someone who you feel comfortable with so that you can ask them all the questions. You can ask follow-up questions. You feel comfortable calling if you don't understand everything. And so he really fulfilled all of those needs for me. So I was very comfortable moving forward with him. So I scheduled the implant removal with Dr. Agha, but he also suggested that not only I remove the implants, but also to do a lift at the same time, which, by the way, I appreciate about him. He's never linear in his thinking. Whenever you talk to him about things that you want to have done, he also has a lot of his own input that me as a layperson, I wouldn't know in the plastic surgery world. So I appreciate the fact that he says, not only should we remove your implants, but also let's think about a lift. And there's this new type of lift. I don't remember what it was called, but it had something to do with like an internal bra. And he's the expert. So I felt very comfortable with his suggestions as to what I should do. So we had the surgery and it was flawless. I felt so much lighter afterwards. It was really a very uplifting thing for me to have the implants removed, to have a much smaller size, to have the lift. And so it just really went well. I was very happy with the results. So then when I noticed that I was starting to get some jowls, my age was really showing. I could tell that, you start to see sagging through this area of your face. I actually made an appointment with him to talk about what I could do face-wise. So I went back to Dr. Agha and we talked about what I believe is called, it was more of like a lower facelift. It was not a full facelift. He didn't want to do that. That's the other reason that I really trust him, is because I honestly went in thinking like I needed an entire facelift. And he said to me, no, you're too young. You're not to that point yet. And he suggested a lower facelift where we were just really working in this area right here just to tighten it and pull it back a little. And also, because I had gained weight, welcome to your 40s, right? I had gained weight. I had also lost some of my jawline, which I was noticing when you're on TV and you see yourself on TV. I started to notice that I had no jawline anymore and it really bothered me. So those were the things that we talked about, and we decided to do a lower facelift. And I don't know what this is called, but he basically sculpted this area in here and it was amazing. It went really well. I thought I looked very natural afterwards. Just not like I was trying to look like someone different or look like a celebrity or look younger. I really just wanted to look like myself again, and myself at, I think I was 45 at the time. So my best 45. And it was amazing. I was so happy with the results. Fast forward a couple years and I see Dr. Agha, and he suggested to me that I have the upper bleph surgery, which is where they take out a very thin piece of skin above your eye, because of course, as you age, that skin starts to fold down. It kind of comes over your eyelid. So I went to him and I had the upper bleph done, and he also did a CO2 treatment, which I don't know if you follow me on Instagram. If you notice, I posted lots of photos of it. It's actually very scary looking, but the pain level is not that bad. I mean, it just feels like a bad sunburn, and the results were amazing. When the bleph healed, I had the space up above again. So when I get my makeup done, I really noticed a big difference where, there was actually room up there to put the eyeshadow on, and also opened my eyes up a little bit. And the CO2 treatment was amazing. The downtime isn't that bad, really. It was maybe like a week. And then it just starts to flake off and you have all this brand new, amazing looking skin underneath. So the most recent thing I had done was back in December of 2023. As most of you know, I had lost a significant amount of weight. It varies between, 35, 40 pounds, which is very significant. And I noticed that because of the weight loss, I lost a lot of weight in my face. And when you lose weight in your face, things start to sag. So I went to Dr. Agha again and I said, is there anything we can do? Do I need a full facelift? Where are we at? And he said, again, not a full facelift. You're not there yet. You're not old enough. But what we can do is use the same incisions that we had used previously for the lower facelift and neck lift. So that way we're not cutting the skin. We're not putting any new incisions. And you can't see any of the incisions that I had from the original lower facelift. That's the thing. He's very meticulous and very detail oriented. And the scars are in my hairline. So you actually can't see them. I pull my hair back into a tight ponytail all the time. And I'm never self-conscious because you can't see the lines. I trust Dr. Agha. I will have every procedure I have going forward in my life because at some point I will need a full facelift. I've talked about this with him multiple times. I will absolutely go back to him for every procedure. And it's not only an element of trust and the fact that he's an amazing surgeon, but it's also just, you want to stick with someone who knows what they're doing. You don't want to shop around. You don't want to go to different plastic surgeons. You don't want to try to get a deal. You don't want to visit one and then go to another. I have been with him for so long that he knows my history. He knows what my skin is like. He knows what I like, what the outcome should be. And so I really just trust everything to him. And to get to where I'm at and where I feel confident, it is not only just plastic surgery and it is not just working out. It has been a combination of a lot of different things that have worked for me personally. I'm the most confident I've ever been. I mean, probably since my 20s, and I feel great about myself. I wake up every day in a good mood. I can't wait to go to the gym. I can't wait to work out. And now I feel like my face matches my body. When I lost weight, I got really fit and I was working out in the gym every day, but then I could tell that my face was sagging a little bit. And then it was like, you get your body in shape, but then your face falls behind. So now I had to get my face to match my body. Anyway, all I'm saying is every woman has their own journey and has their own choices. We're all just trying to be the best version that we can be. And whatever that choice is, we should all support one another. I just want to thank Dr. Agha for coming along with me on this journey. He's seen me go from probably see, now I'm going to get emotional. That's how much I love him. I get emotional when I talk about him. He's seen me go from like very insecure, overweight, not feeling like myself, to getting to the point at 48 where I feel the most confident and beautiful that I've felt in years. And so I thank him for that. But also it has to do a lot with me and committing myself to being health conscious, to changing my eating, and to working out all the time. So again, it's a combination of a lot of different things. You can't just say it's this, or this. We all have to find what things work for us, put those together, and create our own path in our own life. Also, whenever you have surgery, the post-care is so important. You want to make sure that you have a plastic surgeon that is not only invested in the surgery, but also your post-care. And Dr. Agha has always been amazing. Every surgery I've ever had with him, he always texts or calls. Actually, immediately, and I'm still groggy. I'm like, I can't talk to you right now. I need to nap. But he's very caring. He's very concerned. He wants to know how you're feeling. He'll tell me to take a photo of something and send it to him to make sure everything's going and healing. He's just very invested, not only in the surgery, but you as a person and your journey and your aftercare and also your confidence. He really wants to see the patient have confidence at the end. And it's not just about changing your body, it's about changing your life. Because when you change your body and you build your confidence, all of a sudden your life starts to change. You feel better, you get up earlier, you're more invested in working out and in eating healthy. It just makes you happier when you feel good about yourself. And that's what he does. He really makes you feel a million times better about yourself.